Hello, and thank you for taking the time to review my presentation for the Spark Grant. My focus is to make essential healthcare needs accessible to all, regardless of income. A bit about me. My name is Krista Bailey. I'm a licensed EMT, and I'm currently in nursing school to advance my healthcare knowledge and my healthcare career. I am also someone who lives with a daily chronic illness called hypereosinophilic syndrome. It's a really big word that means I have difficulty breathing and severe asthma symptoms due to fluid buildup in between the lining of my lungs. This also means that I have a suppressed immune system, so I am at the doctor's office frequently, whether it's for illness or I'm having a particular time in my life where I'm having a really difficult time breathing and I need some help. As we all know, lots of doctor's appointments add up to paying out of your pocket, and it can get to be really expensive between the visits at the doctor's office and the medications that you're on. Pictured here is your typical asthma inhaler, also known as albuterol or rescue inhaler. They come in all different shapes, sizes, and colors depending on the manufacturer. This little guy is my best friend. I do not walk out the door without an inhaler in my pocket. These are an absolute necessity for anyone who suffers from asthma or other lung-related diseases. Sadly, for those without health insurance coverage, an inhaler can cost about $320 out of pocket. Now, for those of you who do not have asthma, or you might not know anyone who has asthma, a typical inhaler can last about 2 weeks. So that's $640 out of your pocket just for one inhaler. Now, before I was diagnosed with hypereosinophilic syndrome, I was uninsured and I needed 3 different types of inhalers just to breathe every 2 weeks. That's well over $1,000 a month just for the luxury of breathing. If you could, just follow along with me here real quick. I'd like you to take a nice deep breath in and try and hold that breath for as long as you can. Ready? Now I want you to imagine that while you're holding that breath, someone comes up and they take 25% of that air and they suck it right out of your lungs. At my very worst, I only had 73% of my lung capacity. That means 27% of my lungs were completely closed off and unavailable to me. I endured this for 3 years before my doctors were able to find a diagnosis and finally start treatment for me. It's one of the most terrifying feelings that I have ever experienced in my life. It's like suffocating on your own oxygen. You're grasping and grasping for air, and there's nothing there for you. 28.9 million. That's the amount of Americans in 2017 that are living without health insurance, as reported by the National Center for Health Statistics. 5% are under the age of 18. That's 1,445,000 uninsured kids that do not have access to basic health care. This is one of the main reasons that I want to make an impact to drastically reduce those numbers. Now, I know this one's a lot of information, but it is pertinent to the solution that I hope to provide for our local community here in Pierce and King County. In 2003, medical students from the University of Buffalo ran an observational study for 1 year to determine the success rate of their free clinic called the Lighthouse Free Medical Clinic. It ran from October 2003 to October 2004. In that year, the clinic saw 579 low-income patients. 55% of those patients were uninsured at the time of their first visit to the clinic. During that time, the clinic staff were able to assist 57 patients in applying for state health coverage, 23 of which were accepted, but also keep in mind that one application could apply for all of the family members, so it made it a total of 33 applicants. That's 33 people that received health care coverage who would have remained uninsured if that free clinic had not been made available. If it hadn't existed, those 33 people would likely still remain uninsured. Imagine the impact if more free clinics were developed in more communities like ours here in Pierce County. In another study done to test the need of free clinics, 24% of patients would not seek medical care if a free clinic did not exist in their local community. 97% of patients surveyed were satisfied with the care that they had received at their local free clinic. 77% reported greater satisfaction with their medical care at a free clinic over care provided at their primary care. And a really great quote came out of this study. Even with reform of the national healthcare system, free clinics will provide primary care to millions of uninsured. Free clinics should be a staple commodity in every community, but especially in low-income communities like Pierce and King County. What's my solution to this epidemic of uninsured Pierce and King County citizens? A free healthcare clinic on campus at Tacoma Community College. The clinic would run once a month at first, with the goal to operate twice monthly upon success within the first 6 months. A room or space would be sought to rent from TCC directly. The clinic would ask for local nurses and doctors to volunteer their services, and the $1,500 from the Spark grant would go towards supplies such as gloves, medications, Band-Aids, gauze, etc. to get us up and running. For every community member seen, a clinic staff member will offer to help them apply for state health coverage, with the goal to get more of our currently uninsured healthcare citizens fully insured. Should you select me to receive this Spark grant, I would be certain to put the funds towards supplies and medication for the clinic to get established and be operational. I have researched a company called Safety Net Center, where they work with free clinics to facilitate affordable medications and supplies. Not only do they have vendors on hand, but also many additional resources, such as webinars, reports, and case studies to assist free clinics in finding what methods are best utilized. At this point, you might be asking, what steps can I take? Can we as a community take to make an impact on our local healthcare epidemic? Well, first off, you can pick me for the $1,500 Spark grant. The free clinic that I have in mind would be at an ideal and easily accessible location on TCC's campus. The clinic would be open to not just TCC students, but also their children, their parents, and their grandparents. My hope is that with enough word-of-mouth promotion, the knowledge of the clinic will spread to the rest of the community. You can also take preventative measures to ensure your health by going to the doctors for a routine checkup before you get sick, and also by maintaining immunizations such as the flu shot. The clinic can help you maintain these immunizations by hosting a flu shot clinic at the beginning of fall quarter every year to help prevent the spread of the flu. You also want to be sure to eat a healthy, balanced meal, which the clinic is happy to help everybody plan out, and to drink plenty of water. You also want to make sure to get your beauty rest and allow your body the time it needs to heal and recover properly. Also get plenty of exercise to make sure you're keeping your joints and muscles in shape and routinely used so they don't waste. And the two probably more important preventative measures is to first, stay home when you're sick. And secondly, Always, always, always wash your hands. Doing both of these things helps immensely to prevent the spread of germs. I want to thank you again for your time, and please let me know if you have any additional questions that I can answer.